My name is Jose, and today I will be having an FUE procedure. We'll be hitting the crown area today, and I'm just most excited to see those results after the surgery's done. Came in to see Dr. Sean today because I've been curious as to the how this works, how this transplant works. I searched him all. I searched him through Google. He's one of the top surgeons, and I've always thought about it, but never went through. And finally today, I made the decision to finally go through with it, and hoping to see great results. Well, I've been thinking it for over like a good 2 years, and just was trying to figure out like who was the best surgeon, and I found Dr. Sean. I've been seeing his reviews, and people have been satisfied with the results, and I thought I'd take a shot. I think I'm most excited for to have that confidence, because I know that right now it's kind of diminished. I mean, I've always worn hats and beanies, and but I know that with it regrowing, like, man, I'd be super confident to approach, you know, someone and be able to like just have that confidence and not worry that they're looking at my bald spot. But yeah.
Hi, good morning. I am John, who's one of our patients who is here. I'm going to be doing a hair restoration on him. Now, the focus of today's hair restoration is on the crown area. So I'm going to have you please turn around, and but just analyzing. So this is the back of the scalp, right? And this is the donor region. Now, when we look at the donor region, right, I've already looked at this under microscope, and this is one of the most important things. So the doctor has to evaluate all the hair. We know that even here there's slight thinning process going on in the future, and we know that here he's going to recede some more. So the whole point is that the doctor has to think about creating something that is natural, age appropriate, but at the same time, how much more hair loss are you going to have in your future? Now in this case, we know that he's probably going to lose all of this. So we have to calculate the demand and the supply of the hair follicles. If I remove even all of these hairs back here, which obviously I'm not, right? Or like 50 or 60%, am I able to cover the entire region, right? That gives a natural, seamless, age appropriate, basically illusion that you have a good set of hair. And that's the key. So today we're just going to be focusing on this area. Now let me just talk about, so taking that into consideration that he's going to lose more, he is limited in terms of donor, how much he has, right? How are we going to design this? And the design is very important. Look, anybody can just extract grafts and just throw it in there. It's the design, because the design will allow you to extract and use less grafts and give a better illusion with less grafts. And that's the key. It's not just to use all the grafts that's there at one setting, because you're going to need more as you get older, as you lose more. Okay, so in this case, this is the crown area. Now, one of the things that we're going to be noticing is that the calic is here, and all the hair go in a forward direction. And that's where we want to focus. And also remember that nothing's done on straight lines. I see a lot of work be done on straight lines, and that's a mistake. Things are done on zigzag patterns. So I'm going to demonstrate, right over here. So basically, this is where the calic is. Everything done on a zigzag pattern, and the hair basically goes in this direction. Now, why is this so important? Because whatever you put here will give you oomph and volume down the line, and by following that direction at a very flat angle, it will give you nice illusion. So I see a lot of hair transplants in the crown that the hair is placed like this. And that's wrong. The place has to be done really flat, placed very flat, so it gives a nice illusion. Now, again, we talk about in the future he's going to be losing this area. So why don't you say, well, Dr. Sean, why don't you also fill this area? Well, because most of these are going in a downward direction. Okay, so does it really make sense to take hair from here and put it here going in a downward direction? No, not really. You could use beard hair or other stuff. Good quality hair, which you have limited donors of, right, should be placed in the areas that is going to give you the biggest bang for your buck. And this is the region that we're going to be focusing on. thickening it, and then in the future as he loses more, we're just going to establish a hairline so that everything is continuous and seamless and natural, and that's very important. Also remember that you can't remove all the grafts back here as well, so everything has to frame the face nicely, harmonious, and that's actually very, very important. Do you agree?
Yes, I agree.
Perfect. Wonderful. Excellent. One of the few issues that I see continuously when I see patients from around the world is that in one session, right, some people try to get 4,000 to 5,000 grafts and put it right here. Well, what would happen in the future when you need more grafts? These guys get in trouble, right? And 2,000 grafts is a good ideal amount for this case. And we're going to be doing it. So I'm also going to be identifying the area in the donor region that we're going to be extracting the grafts from, and this is the area. And again, remember that I know he's going to lose these in the future, so I'm going to go below that, right, because that's part of the donor area. Perfect. This is the part I'm going to be shaving the back of the scalp to expose the donor area. Now, we don't shave in every case, right? Especially in women, right? Or people that want minimal shaving. We don't have to shave the whole case. But in this case, we're going to shave basically the entire back side of the scalp. So, and I know I see a lot of videos online where they just take a razor and shave it. But you know what? Everything is an art, right? And I do it myself because I'm the one extracting, and I know the amount of hair that needs to stick out of the skin. And the reason why that's important is because some people have curvatures to their hair, so you want to account for that. So I shave a bit and then I measure it. So these little things are very, very key. Now, one thing is that I don't like to shave the whole head, and especially for the crown area, I like to leave a buffer where we do the transplant and where we extract the grafts. So as you're cleaning the area, you kind of know, where to touch and where not to touch. And also, I just feel that most people don't want me to shave the whole head. I have a lot of professionals, doctors, attorneys, people that go to work. So I try to really shave the minimum. This area will we go back in 2 weeks and look decent. Again, I'm redrawing what I call the safe zone. So again, important parts when you look down is this area we're going to be covering. I shave this area. I trim the rest with the number 1, number 2. So this area, once it heals in 2 weeks, things blend in nicely. Again, I don't like to shave the whole thing. Most of my patients don't like to. Again, he has to go back to work next week, so we have to, get him ready. So perfect, excellent. So the whole point of the procedure today, right, is to cover the crown area. Now, you have to put everything in perspective. This is a gentleman in his 30s, right, who has a significant family history of hair loss, right, who will definitely lose all the hair in the frontal region, who has a limited donor area. So you can't just be overutilizing and over harvesting all the grafts in one session. It's not going to look nice, and I see this all the time where people have like 4,000 to 5,000 grafts all in one session. They're really young, they have nothing left over for the future. So please take that into consideration, because I see a lot of mistakes and I don't want it to happen to you. In this case, right, we already know that this is the area that bothers him. This is a great hair loss pattern because a lot of the hair loss is occurring in areas that are going in a forward direction. So whatever graft you put here, when you let it grow along, it's going to give you illusion 1 inch down the line, and we're going to be following the natural direction of the hair itself. So as you lose more, there is no gap obvious immediately, so you're able to cover it as basically you get older. And this is what it's all about, right? It's about thinking what will happen to you, to the hair, to the balding area 10 years from now. Will it look natural? Will it look age appropriate? Will you be able to conceal it? And will you have more hair to add? Now, my goal is not for people to come back immediately, right? However, we know that hair loss is progressive, and today is just a snapshot, right? And in my experience since 2008 doing this, right, I know that being conservative is the most important thing. Patients love it because the donor heals well, they have enough for the future, it looks good, you know. I see a lot of people, unfortunately, who get these 4,000 to 5,000 graft sessions, and unfortunately they have nothing else to give for the future as they lose more. So in this a great example of the crown. We're going to go through it. I'm going to demonstrate how it's done and how he gets good results. Follow me. Perfect.
We just finished the procedure. We're about to go home, and the procedure went well. I felt very comfortable. I felt very taken care of. The time went by faster than I imagined. I thought it was going to take, I thought it was going to be slower, but it went really fast. I feel satisfied, and I can't wait to see the results. It was great working with Dr. Sean. He always took care of me. His staff as well was looking out for the best interests of me, and yeah, just an overall great experience with him. I'm really excited for going out on like dates and going out with my friends, having just a new different look, and having that confidence to, you know, speak to speak to different women. And, yeah.